Hello everyone, my name is Sophie Meunier. I'm professor at the Université du Québec à Montréal and director of the Occupational Health Research Laboratory. I'm here with
Camille Roberge, PhD student in work and organizational psychology and member of the Occupational Health Research Lab.
Today we would like to talk to you about the result of a study we conduct on self-management strategies that promote your mental health as a worker. But first, what is self-management?
Self-management is a set of behavioral, cognitive, or emotional strategies that an individual puts in place to manage their symptoms, optimize their mental health, and prevent relapses. In other words, self-management represents all the little things we do to maintain our mental health on a daily basis.
When we are at work, there is sometimes less latitude when it comes to the self-management strategies we can use to promote our mental health. This is in part due to the schedule we have to follow, the task we have to perform, and the interpersonal relationships we have to maintain with our colleagues, our customers, our employees, or our supervisor. So as a research team, we ask ourselves, what are the self-management strategies that people can use at work that will help them to function effectively while maintaining good mental health?
So to answer this question, we conducted interviews with 25 workers from various job sectors who had symptoms of anxiety or depression, but who managed to keep their jobs and function effectively at work. We asked them to share their self-management strategies, the tips they use to manage their mental health while they are at work.
The results of the interviews were very rich and allow us to compile a list of more than 50 strategies that can be used in the workplace to maintain good mental health. Today, we would like to tell you about the most popular and effective strategy according to our participants.
First, a large number of participants told us about strategies that allowed them to empower themselves as a worker and to feel that they had a little more control over their work. It could be small, simple things like deciding on their task, their schedule, or their place of work based on their psychological state. For example, some participants preferred to end their day with less demanding tasks that require less concentration because it's better match their natural rhythm and their energy level, which decreases as the day goes on. Several also spoke about the importance of setting limits and the time and energy they devote to work and of learning to say no. Finally, a few point out the importance of taking ownership of their own workspace, such as by adding accessories, photos, plants, or any element that allows them to feel at ease and comfortable at work.
Then, several participants mentioned strategies related to self-compassion. This could mean, for example, forgiving themselves and accepting that their work is not always perfect and that they can make mistakes. It also meant being able to move on when they made a mistake and even to see it as a learning opportunity. Of course, no one likes making mistakes, but all the training and development literature tells us that this is one of the best ways we learn.
Several participants spoke to us about the importance of taking breaks to boost their energy, whether that simply means leaving their workplace for a few minutes to clear their head, having lunch outside, taking a walk, or going to the gym.
The participants also told us about strategies related to managing their thoughts. Most of those strategies revolves around self-observation to identify and replace inappropriate or distorted thoughts. Participants use phrases like, "we're not saving life," or "we're not doing open heart surgery," to put things in perspective and avoid dramatizing the situation. By developing better self-observation and monitoring skills, participants became more aware of early warning signs of mental health issues and could be more proactive in taking action before a situation escalates.
As in all studies in psychology, finding social support emerged as a particularly useful strategy for our participants. Some noted the importance of knowing when to ask for help and daring to do so when they need it, rather than waiting until they were completely overwhelmed. Others stressed the importance of knowing how to choose the right people to talk to so they could access various forms of social support, such as practical support with work tasks and helping managing emotion and mental health at work.
Finally, for many employees living with symptoms of anxiety and depression, time management was often a major challenge. Some participants had developed strategy to make this aspect of their work less difficult and stressful. These include setting priorities, making to-do lists, and using time management tools such as an agenda, automated notifications, or reminders.
So these are the main strategies we wanted to share with you today. Obviously, there are several factors that can influence your mental health at work, but self-management is really one thing over which you have control, and it's something that you can do on your own to promote your mental health at work.
We are very pleased to have been able to present the preliminary result of our study in this short video. We hope you will find this information useful. In the coming weeks, we will prepare another video about the second part of our study. It focused on self-management mental health strategy that can be used outside of work to allow workers to recharge their batteries and come back to work in better shape the next morning. We can't wait to present this video to you. Thank you for watching.